Hello, my name is John Millwood. I spent all my working life in medical practice. The early years, and there were quite a few of them, were spent as a GP in a family practice. To begin with, the workload was not particularly high, but as the years went by, it became obvious that something was going dreadfully wrong. The number of people who were chronically ill was increasing, and we were seeing people with cancer far out of proportion to what I'd been used to when I started as a doctor. As a practice, we raised these queries with the authorities, and we were told that no, there was no increase, that we were just unlucky with the patients we had. But you could no longer ignore the fact that despite what we'd been told, that the numbers of people suffering from cancer and other chronic diseases was increasing. In time, even the authorities had to accept the fact that things were getting worse. The more I looked at it, the more I found that the practice of medicine today was not coping with the demands, and that the early years, where it seemed as though that medicine was going to go and cure most diseases, had been a false dawn. And in actual fact, the practice, as it was not working at all. At this time, I began to look at alternatives, look at the sort of medicines like homeopathy and acupuncture and herbal medicine that we'd been told were quackery. Much to my surprise, I found that these therapies worked. And so for a while I worked both in the NHS and doing work on the side with homeopathy. It reached such a stage that eventually I decided that I couldn't practice normal NHS medicine anymore because it wasn't working, and it was not in the best interest of the patients or myself. And eventually I retired and went into alternative practice. With view from the outside, it became obvious that I was right and that things were very, very wrong. And therefore I decided to write a book which was called The Treason Within. It may seem a funny choice of title of medicine, but it actually really described the way that the practice of medicine was being destroyed within, both by the scientists and the drug companies and the doctors themselves. The idea of the book was to write in terms that a layman could understand what caused disease, what was wrong with the practice as it was now, and how people could not only diagnose themselves but could treat themselves. This book took about 3 years to write, and I thought that that would be the end of the matter and that we'd better progress from there. But in recent years there's been a lot of talk about prevention of disease. Now that's a subject that's been around since when I was a medical student, so it's not a new topic. We've always been promised that more funds would be spent on prevention, the idea being, as the meaning of the word says, that prevention would stop disease in its tracks, stop it from happening. What I found was that in the last few years, what does come to mean by prevention, and this is all the way down from the government right the way through to the chief executives of the various trusts, even to the doctors themselves, and what they mean by prevention is early detection. Now it's quite obvious from the dictionary definition that that has failed prevention, and that all early intervention does really is to extend the time in which people are treated, and the end result may be no greater than if they'd discovered it later. So all the idea of early intervention saving lives and having more effective treatment is probably a false premise. And then obviously if you watch television today, that we're looking more and more at individual diseases, whether it's Alzheimer's or allergies recently, that you ask the consultants, what's the cause? And they now frankly admit they do not know. Now this to a certain extent is very, very wrong, because the causes have been known, and they were known way back 40, 50 years, particularly the effect of nutrition on disease. And yet, we're still being told we don't know what causes the disease. Now, if you look into nutrition, and if we just take one particular mineral that's in our food, or in some of our food, selenium, it is involved, and shortage of which can be in cancer, multiple sclerosis, scoliosis, Alzheimer's, heart attacks, cataracts, pancreatitis, in fact a whole multitude of various illnesses, chronic illnesses, hormone illnesses, thyroid illnesses, all sorts of female problems. They all involved the shortage of selenium. Now, this is recorded, it's been known, literature's full of such comments, and yet surprisingly the health service does not measure selenium. It will not allow the doctors to do that. And this has all been authenticated, if that's the right word, by even the Chief Medical Officer of Health. This is, in my view, criminal, because it means to say that up and down the country many thousands of patients are being condemned to ill health, suffering, and usually eventually death, all because they don't treat them for shortage of selenium. Now, we are told that whatever reason there is for the failure to measure these minerals, we are told that if we have 5 portions a day, we'll be okay. And we hear this again from the Chief Medical Officer for Health. And yet, we know that different sources of food produce different quality. We also know that if you cook it in the wrong way, you can well end up with no nutrition at all. And yet, another department of government keeps on telling us year on year that the amount of nutrition in our food gets less and less and less. And we also know in some countries where there's absolutely no selenium in the food, the incidence of cancer may be as high as 1 in 4. So why can't people put 2 and 2 together and come up with a sensible view? There must be something criminally wrong somewhere. It is now time, I believe, that patients demand that these tests are available. Why should people be allowed to suffer, say, with cancer, when almost everyone who has cancer is short of selenium? And apart from cancer, shortage of selenium will reduce the immunity, particularly the immunity to other diseases and also the immunity to the actual treatment itself. It is possible to know the cause of disease, easily found in my book, The Treason Within, but I believe now that there's no point in lobbying us. I think individual patients must now demand from their doctors, from their specialists, from their primary care trusts, that their blood samples are tested for selenium. If not, the knowledge is there that I believe that we should condemn people and report them to the GMC or other bodies because they are negligent. Read the book, it will give you the information. The information is out there, only from my book, but many other books too. I wish you well, and if we can help you in any other way, I'd be very grateful if you would contact me. I hope that what I have said now has been of help to you.